with Veterinarian to the Stars and my dear friend, Dr. Patrick Mahaney. Hi, Patrick.
Hey, thanks so much for having me. It's fine. We're having the strangest weather in Southern California. It's dry almost all year, but it's been raining almost continuously this past week. So this is a moment of dryness in my backyard in West Hollywood.
Wow, it is beautiful.
Thank you.
We have kind of chilly on behind my fire going behind me here in Philadelphia, so I can't say I'm not jealous.
I remember all the cold marches in Philadelphia and the DC area as a child and as a young adult, so I don't miss it all. I have a fire pit too. Here's my fire pit right there.
Wow.
It's on. We'll do a tour of my backyard. So here's my grill.
Wow.
And our built-in kitchen.
Oh my gosh.
Here are my little baby plants that are growing. I'm a big plant propagator. These are a lot of vintage pots and things that I rescued. And here's my newest addition, which was given to me by my friend Richard Klug, a huge staghorn fern.
Wow. I've never seen one of those before. That's beautiful.
It mounts on a wall, but it's not quite mounted yet because we're going to there will be no wall there because we have the condo next door as well, and our friends are moving out, so we're reclaiming the space to use as my office. So I will actually have my own personal office, not just working off of the laptop.
That's exciting.
Yeah, very exciting.
Wow. Well, mine's not as exciting. I have Plankton here again. He's always
Plankton! Yay!
And tonight, Phoebe is here, but Phoebe's a little camera shy. She's my ragdoll cat that is has the zoomies right now and is flinging herself about. She's a baby. She's only about 7 months old, and she is flinging herself about the living room. So maybe she'll make an appearance.
Hopefully. Does she and Plankton get along well?
They do. I followed my own rules and was very slow in their introduction. Mm-hmm. And I have 2 kids. My youngest is allergic to cats. Okay. And she gets like hives and the whole 9 yards. So Phoebe mostly spends her time on the third. We have a pretty big house with a 3rd floor, and my mother-in-law and my older daughter live on the 3rd floor. Oh, wow. And so Phoebe mostly lives up there. Okay. But we have her down out and about. It's such a sin because my little one worships animals. She's never walked by an animal she didn't love, so it's kind of cruel. But serious zooming happening around here. I don't even know what that was. I'll figure it out later. But now she's down and out and having a big time. Are you? I know you lost your dog recently, right?
Well, almost 4 years ago. It was,
oh my gosh!
It was November 2016. That's when I put Cardiff to sleep after a lifelong struggle with autoimmune disease or immune-mediated disease. He had immune-mediated hemolytic anemia 4 times and a T-cell lymphoma twice. So we are taking a break from dog ownership because I spend 5 to 7 days a week in homes with clients and their dogs. And then sometimes when my clients travel, we take care of their dogs. So it's like being an uncle or being a foster almost. Well, and that's kind of enough of a dog fix for now.
Well, let's talk about your life because your practice is pretty unique. So most of us that are practicing are seeing dogs and cats in our hospitals, but that's not how you do it. And I think in this time when we kind of don't know which way the world is spinning day to day, the veterinary profession is going to have to get a little nimble and find creative ways to care for our patients. And house calls might be one of them. So I think both for the veterinarians watching and for the dog and cat parents out there watching, what's that like?
Yeah, well, it's been an interesting. I've been in practice for 20 years. I graduated shortly before you did in 1989.
Are you telling
No. Don't worry, I won't reveal your age because actually I'm not sure exactly where I'm 40. I'm 46.
I had him when I was 9. Yeah.
I'm 46. I've been practicing since I was 25. After I finished school, I did an internship in Washington, D.C., planned on being a veterinary radiologist, but didn't get into residency program, so I went right into general practice. Stayed in the D.C. area for a total of 5 years. After 9/11, I was like, okay, I have to figure out an exit plan because it became a very hostile place to live. So I was doing general practice with Banfield, and that wasn't quite the right fit for me. I did that for 1.5 years after my internship. I did emergency only right outside of D.C. In Rockville, Maryland for 3 years, which was great, like very much more my interest level and how I like to practice, but the emergency hours were crazy and I wanted to go different. And At the time, I'd gone through yoga teacher trainings and certifications. So I was teaching yoga part-time because I would have these gaps of time in between my emergency shifts. I'm like, might as well do something else. Social media wasn't around at the time, so there wasn't as much to do. And so I
I
became
didn't
a
know
yoga
that.
teacher training part-time. And then I got out of DC, went to Seattle because there's a good yoga community there, and I can really get a job anywhere I want. So moved there with a partner. Liked Seattle some, but we wanted to buy a house. It was too expensive to buy a house there at the time. So we moved to Olympia. My partner and I broke up, and a friend of mine from yoga teacher training had just moved from Manhattan to Pasadena, where her family was from. And she, at a dog park, met a woman whose husband is a lawyer and co-owns two practices in Southern California, one in West Hollywood, one in South Pasadena. And so she calls me and says she met this woman whose husband is the co-owner. The next call is from the husband saying, "Hey, my wife met your friend at the dog park. Do you want to come down and interview?" I'm like,
Oh my
I
God.
just had a relationship end yesterday. I've always wanted to live in Southern California.
Wow.
Yes, I'm going to come down and interview. So January 2006, I interviewed, signed a contract, moved to LA in March 2006, worked in West Hollywood at a 24/7 practice where I did like sometimes 24-hour shifts. We also had internal medicine in the practice. That was really good to share a lot of cases. But at the time I was going through my veterinary acupuncture training, and I've always wanted to have my own business. And so I figured out that doing acupuncture in a stressful 24/7 practice is not the right fit for the
Yeah.
patient. And
Yeah.
also, like, most of my patients at the time were old arthritic dogs. It's hard to get them out of the house, into the car, to the hospital. It's noisy, there's smells. So I figured, I had my aha moment as I was driving Cardiff, my dog, to dog parks. I'm like seeing mobile veterinarians and mobile groomers and mobile everything. And I figured I should just have my own house call veterinary acupuncture practice. So California Pet Acupuncture and Wellness was born in 2008. And I started just small, doing acupuncture and herbs and some Chinese medicine nutrition consultations. And then started adding more services over time. And basically now it's a concierge integrated veterinary practice where I manage clients' illness and wellness. And I really try to provide that level of service that's above what most veterinarians are able to provide during like a 20 to 30-minute appointment. I'm going to clients' homes. I'm in their homes for an hour to 2 hours. They're communicating with me about all their issues, all their needs, and what I can solve, I do, and what I can't solve, I partner with specialists and emergency practices to do. So it's a really interesting way to practice. It's what I call my last veterinary job.
So I was getting information from my friend who's a professional singer
Oh,
that my mic is not the best. So I
okay.
apologize, and I will keep working on that. But I'm so not tech savvy that I think I'm gonna even go with second best tonight, and I'll keep working on it. So thank you, Michelle Lordy, jazz singer extraordinaire. So that is an amazing journey. I mean, one day your life gets blown up, and the next day you start this whole new amazing adventure.
Yeah, every day is different too. I mean, some days are busier, some days are less busy. Right now, things are a little in flux with COVID, but at the same time, I'm managing it. I still have clients that I'm going to see on a regular basis, and we just take precautions. I mean, they may or may not be sick. I may not be sick. We don't really know at this point. I'm feeling really good on a day-to-day basis, and I every day take steps to try to make myself healthier in terms of eating well and exercise and trying to have good habits overall. But I could be exposed at any time. Gyms are closed, yoga studios are closed. I'm really just going into public places to go to grocery stores at this point.
Yeah.
That's it.
Yeah, it's scary business. It's scary business.
It's a little bit.
So before COVID, you're saying you get to go to your clients' houses for hours?
Sometimes, yeah. So my initial consultation is generally about a 2-hour process.
That's amazing.
I don't like to rush through anything at all. I like to go and really get to know the person and a lot of times their support staff as well, and explore the household, because you want to look around the home to make sure there aren't places where the pet could be exposed to trauma or toxins. So it's a very long process of weeding through sometimes very complicated medical histories, and I'm really delving into all aspects of the pet's life, from origins to travel to other pets in the house to foods to treats to supplements to day-to-day habits. The whole examination process, collecting diagnostic testing like blood, urine, and feces, skin scrapings, whatever really needs to be done, I'm doing. So I want to have it be a process where nobody feels rushed. I don't like to feel rushed when I'm going about my day-to-day life, and I want the client to really understand that I'm there to listen to whatever they have to say and to really best understand what's going on with their pets.
So it does bear noting that there's economics involved. I mean,
Definitely.
at most of our veterinary hospitals, we are trying to provide the best care possible, and very sensitive to the fact that healthcare for people and for animals is so expensive.
Yes.
So we are rushed through our appointments, and we, you know, something's got to give, and I'm not sure what it is. And maybe this time, where the world's going to spin in a different direction, gives us a chance to reorganize. But most of our appointments are only 15 or 20 minutes, because that's what we can do at an at the most affordable price for our clients in a veterinary hospital setting. So in your world, you have to charge for your time. So it's not necessarily accessible to the average person.
I have some people that I've been working with since I started, and I've just barely increased the initial fees. I've been made to realize, with the amount of time that I'm investing and effort I'm investing into my patient care and client communication and just helping them through whatever process, that I was way undercharging for that time. I'm in an industry. I'm Hollywood adjacent, I always consider, because I work with a lot of entertainment people, and I know a lot of people who also are service providers for the industry. And so they do provide services on a more personal basis. They do provide services at home. There are some challenges that go into just that whole management process. So I've recognized that I've needed to increase my fees over the year. And so now I'm working in a realm of clientele that, like, what I charge often is not significant to them at all. They spend more money on a shirt,
right,
or their children's shoes.
Right.
Okay, well, I'm really not that expensive then. But I feel as though
in our world, really, what we have is our education. So
yes.
we charge for our time. And I think that, but if you're only able to see 3 or 4 clients a day, for you to make a living, the charges have to adjust accordingly, because what you're talking about, I think, would be most people's dream come true. I mean, we love our pets so much, and we want that thorough, incredible interpersonal relationship with our care providers. And like what you were explaining, how you can go through the house and think about all the variables for them. I mean, I talked last night to Dr. Amy Pike and Tabitha Kucera. We were talking a lot about behavior and being able to observe pain, and how the house is set up in the house makes such a huge difference for how we can care for them. But it's not really accessible for most people. But you have super exciting people. Now, I guess we have to be a little discreet about your fabulous life. But
I have some clients I can talk about, but like I helped Jane Lynch and Bryce Towers Howard before she mostly moved to New York, and lots of people I could say, but probably won't say. Demi Moore, I can say her because I've gotten to know her so over the years, and like when her book came out, I posted a photo of she and I and her book and her home and her pets. So I do have people that I can say, but a lot of people I could but shouldn't, because I do like to be discreet and private, and I don't want to talk about their lives. But it's really, really interesting to be part of the whole support staff wheel cog, because there's so many people coming in and out to do various services, and you just kind of get brought into that fold. And what's really great is I really now just work on a referral basis. So it's my existing clients referring me to their friends and family, or I have referrals from specialty veterinarians who know the kind of level of practice that I do. I try to practice like a specialist of general practice in terms of interpretation of laboratory results, sharing of information, going like the extra mile to research problems, engaging specialists. Even like through IDEX, they have amazing specialists. That IDEX is a laboratory that I commonly use in my practice, and Antech is another big one for those of our listeners out there who aren't familiar. But they provide us the option of consulting with veterinarians about questions that we may not be the most comfortable or highly trained in answering. So I constantly consult with them or other specialists just to try to give my clients the most experienced answer.
That's amazing. How lucky are they to have you, really?
And I know to have them.
And I know how devoted you are. In fact, I was just watching, my kids are obsessed with the show Psych. For anybody with kids that you're locked up with, Psych is it's a show that, kids, it's appropriate for kids, but also really entertaining for grownups. And Jane Lynch was just on Psych, and I was telling my children I'm going to go talk to her celebrity veterinarian.
Yes, I love going to her. She's become a good friend over the years.
And the thing that's so wonderful is they are just people, and people with a talent, of course, and a really extraordinary life that love their pets, right?
And pets are really the great equalizer. Everybody can talk about their pet. Everybody loves their pet the same. You can talk to, really when you're interacting with a person that maybe you've admired from their entertainment work for your whole life, or even recently, just really depends on how well you know them. It's interesting to kind of break down the barriers and just have it be a conversation about pets. Like, I don't go into clients' homes and be like, oh my God, I loved you and this and that, and I followed your music for years, so I've wanted to, but I really try to keep it as discreet as possible, because I don't want to come off as like somebody who wants things from them.
Of course.
Maybe as we get to know each other over the years, there could be an opportunity for like a social media post, but I never in my clients' homes be like, hey, can we take a selfie together? I'm like, if I get invited to their event, or there's some kind of respectful way for me to do something like that, then yes. But otherwise, it's all just I'm there to be a service provider. I'm not there for your autograph.
And I like the way that you put it, pets are the great equalizer. I know Ellen DeGeneres had a dog. I think it was a dog, right? Who she had to put to sleep a few weeks ago, and was devastated and had to take a few days off from work. And
Sure.
Any of us out there who've lost a pet know that feeling. I mean, so it is very humanizing.
Absolutely.
Yeah. So one of the reasons I was really excited to talk to you was I was thinking so much about kind of the state of affairs. So there's the world is changing every single day. And sorry for the dog nose in my.
That's cute. I love it. Hi, Plankton. I love your name.
My boy. We're just going to snuggle here while we talk. And my daughter's over here with Phoebe, so it's like Dr. Doolittle over here. I love his teeth. That's awesome. But we were talking a lot about behavior, and as we talked about behavior, really the subject of pain kept coming up.
Yes.
And people are going to be home more theoretically right now with their pets, and maybe noticing signs of pain. So I was wondering if you could maybe give me and our viewers at home a list of things they might be looking for where they just thought that was normal, but no,
Sure.
that's
Well, definitely, I think one of the main reasons that pets have behavior changes when they're adults or senior is because there's some other underlying medical problem. And if we're around to observe it more, some of the things that were subtle that we may not see because we're running out of the house, getting to our jobs and take care of kids and such, could become more obvious. So I definitely think kind of a slowing down type behavior, maybe a lack of ability to move quite as well, difficulty going up or down stairs, up and down off of elevated surfaces, discomfort to the touch, certainly not wanting to be touched in a certain place, and possibly turning and biting. This is hilarious. I love your dog.
love them
And then not wanting to interact with other pets in the household as much, possibly having a reduced appetite, possibly even problems chewing, depending on where the pain is coming from. Like if you have some kind of periodontal disease and you have teeth or a tooth that are not as healthy as they should, problems chewing the food or chewing on one side of the mouth. I mean, there's a TV show that was on Animal Planet for a couple of years called My Cat from Hell. And I know Jackson Galaxy through a mutual friend, and so he had me come on the show for 3 episodes where I went to the cats' homes and he did the initial assessment, then I went and did a medical assessment. Sometimes the cats would come in and meet me at Veterinary Cancer Group and would do more of a diagnostic workup with radiographs and ultrasound. And really anytime there's a behavior change in an adult pet, I'm very thoroughly investigating the potential for underlying medical problems with physical exam, blood and urine testing, fecal testing, X-rays, ultrasound, CT scan, MRI, whatever really think is needed. And especially even on that show, there was mostly adult to senior overweight cats that had osteoarthritis in their spinal facets, in their hips, and their knees. And when you got them to lose weight, modified their environment and lifestyle, started them on oral chondroprotectants or injectable products like Adequan, put them on fish oil, they were happier and healthier. I also did acupuncture and laser treatment on them. So really, like, however ways we can do multimodal pain management, if that is the cause of the behavior change, then great. A lot of times older dogs will have hypothyroidism, and that certainly makes them grumpy. So getting the thyroid managed so that they lose weight and become more active and just have better day-to-day lives. There's so many aspects of that I think are really important to look at, not just like, okay, there's a behavior change and it's not something, nothing I can do about it. It's let's investigate all the medical problems and try to mitigate the medical problems. And then if you can't find a medical problem, then certainly going the route of behavior modifying medications, veterinary consultations with behavior specialists.
It's a time now where a lot of people may not have access to veterinary care for a little while.
Sure. Oh, yeah.
If they're in different quarantine areas or they themselves are quarantined. So I was thinking a lot about that. If you can't get to the vet and your dog or cat is having painful issues, one of the things I am going to talk about in every single episode is please, please, please do not reach for human medicine for your pets.
Absolutely.
And in the event that you think you might be able to use something in the house, they are dose dependent on the weight of your pet. That human beings we're all kind of close enough. And so the adult dose is sort of the same. Everyone takes 2 Advil, but that is not what it is for dogs and cats. And those drugs can be deadly. So please, please, please call your vet and ask them what you should do if you can't get care. But other than medicine like that we think of as pain relieving medicine, I really like some of the things that you talked about for pain relief. I mean, one of the things that doesn't get as much conversation because it's kind of awkward and uncomfortable is obesity. I mean, there's a lot of studies that simply getting your pet to a healthy weight will relieve the pain of osteoarthritis.
Absolutely. And extend their life, their healthier lifespan by 2 years or more, in dogs at least.
And I think we should maybe, when you have some more free time, come back and talk about weight management. Because I know, speaking of Jane Lynch, that you guys worked really hard with a dog that she adopted to get to a healthy weight and what that experience was like. Yeah.
Arbuckle, the 120-pound dog who should have been 70.
It's amazing. It's amazing. And particularly for cats, but also for dogs, we want to think about a medically supervised weight loss plan that they're getting the nutrients that they need and appropriate calories divided up with snacks and all that stuff. There's kind of more to it than just winging it.
Part of what I find like I'm able to do because I take more time, I allow for more time than what is generally allowed for in veterinary practice is calculation of resting energy requirements based off the pet's intact or neutered or spayed status. If they're a growing puppy, 4 months of age or less, their metabolism is super fast. If they're over 4 months, it's slowing down. If they're adults, then it's definitely slowing down more. So calculating their RER and how many calories they should eat for this point in their life, looking at the current food or combination of foods and figuring out ways to achieve that calorie goal, minimizing calories from treats or using healthier low-calorie treats. So it's a pretty complicated equation when you're like looking at 6 or 7 different contributing components, from sometimes multiple types of food to multiple types of treats to human foods that get added in. So I always kind of try to recommend the quantity of calories per day is less than what the pet generally needs, because usually extra calories get added in. But if you really kind of guide people through that process and give them measurements to stick with, usually they can, unless somebody's cheating on their diet.
Because what most of us as pet owners think about is I'll just follow what's on the back of the bag.
Yes, which is a huge range usually.
Huge range. And doesn't account for any of those variables that you talked about. And so just winging it with that number often ends us in trouble.
Yes, your dog weighs 10 to 20 pounds, but should eat 1/2 of a cup twice a day.
Yeah.
That's too big of a range.
And the other thing that I think with us being home more that we should talk about is how caloric human food is. So if your 11-pound Yorkie is, I mean, a piece of pizza to your 11-pound Yorkie is, I don't know, sometimes maybe a day's worth of food or more.
Yeah,
so feeding human snacks can be really trouble.
Right. I mean, cheese is one place. Like, cheese is a great high value reward for dogs, great for training, but small pieces like the size of your pinky nail or your thumbnail. I have some clients that use string cheese to hide pills, and I find out they're giving like a 10-pound dog an entire piece of string cheese over a day or two. I'm like, that's a human portion, one piece. Yeah. So wonder where that extra 5 pounds came from over the past 10 months.
So if you're kind of being resourceful about what is already in your home, what are your favorite, if you, I know you are a big proponent of fresh food for pets. So
Absolutely.
what are your favorite calorie regulating human foods that you recommend for your, let's start with cats. Anything for cats?
So little cats, I tend to think of more, let's just feed protein. So maybe some dehydrated chicken or liver, or maybe some fresh low sodium deli kind of treats, or maybe whatever you're preparing for dinner yourself, some fresh cooked fish, fresh cooked chicken, fresh cooked beef, but just definitely small amounts. Trying to make it reward based as well. So you have to engage them in some kind of interactive thing, like maybe taking some of those dehydrated treats and putting them in a Doc and Phoebe feeder and hiding multiple of them around your house, so that your cat has to go upstairs or downstairs and climb up on the shelves, and definitely having to work for their treat.
Yeah.
So I definitely think of gravitating towards whole foods more like that. I tend to not think of fruit and vegetables as much for cats, just because perhaps the majority of my clients are dogs, so I'm really talking to them about dogs mostly. I've less than 10 cat patients, I think. And so generally for treats, we're doing very small pieces of dehydrated meats for the most part, usually commercially available meats, or some of my clients have air dehydrators, so they're doing it themselves. So
we actually have an air dehydrator. It's a handy little.
Do you use it?
Yeah, we do. Not
Cool.
a ton. It's sort of one of those appliances that when you drag it out, you use it for a few weeks, and then you're like, put that thing away.
Right. Like all those apples in the fall.
Yeah. Strawberries too at my house for some reason. So tell us about fresh foods for your dog people.
Well, in terms of treats, like I tend to think of high fiber, high moisture, low calorie treats. Like cucumber is a great one, and also from a Chinese medicine perspective has cooling properties. A lot of patients in general of mine have like heat-based conditions, like arthritis. In Chinese medicine, we have different energies. We have warming, we have cooling, we have neutral, and there are some foods that follow those Chinese medicine food energy principles, and cucumber is one that has a cooling effect. Think of like, what do you do when you go to the spa or when you're doing a home spa day? Cucumbers over your eyes, it's soothing, it's cooling. So vegetables that have that very high moisture content and grow above ground are generally considered in the cooling perspective. Vegetables that are drier and grow in the ground, like a potato, a sweet potato, generally are more warming. Even among those, like sweet potatoes are considered to be warming, but white potatoes are considered to be more neutral. There's like different theories of Chinese medicine that aren't exact science. That's why I always kind of take it with a couple heavy shakes of salt, or whatever you want to think about that way. So I love, anyway, cucumber. Jicama also is a great high fiber, low calorie, high moisture treat that I love to eat with salt and lime juice and red pepper, just like you would do from the street. But right now I'm not buying like street vendor food. So maybe in the future. But also melon. I love watermelon and cantaloupe, pears and apples and berries. A lot of dogs don't really like blueberries unless they're really curious and playing with them. But if you mash them up and they're ripe, the flavor is very plentifully available. I tend to not gravitate as much towards citrus because most dogs don't like really oranges and grapefruit and lemons, but some dogs do. You really never know. Definitely no grapes, no raisins, no currants, none of their juices. I also try to stay away from nuts. Macadamia nuts have a toxic principle for some dogs.
Can you talk about that a little bit? Because that's sort of newer information.
I've seen it before. I've seen it many times in practice where a dog, like the client has a bowl of macadamia nuts out on their coffee table. The dog eats it, and suddenly they have ataxia, which is problems moving their limbs, and it tends to be more centralized in the hind limbs versus the front. For whatever reason, the toxic principle is unknown.
So
I've had clients go to Hawaii and bring back dark chocolate covered macadamia nuts.
Oh my gosh!
And then it's like a gift bag for their friends or their family. And then the dog binges on that, and they're suddenly going to the emergency room for chocolate toxicity and macadamia nut toxicity. So
and I've heard about avocados too. I know you're in sunny California. So what about avocados and dogs?
So it's a little bit of a misnomer, I think, in terms of the toxic potential, because the avocado fruit itself is not directly toxic, but it is high in fat and certainly could cause stool problems because of that high fat consumption.
Okay.
But avocado skins, seeds, leaves, and stems all contain persin, which is persin. It's I can't remember the toxic principle, but it's irritating to the gums. It can cause vomiting and diarrhea and decrease appetite. So that technically can be toxic, but it's probably not going to kill your pet. It's not like an aminoglycoside or something like that's going to cause cardiac problems. or something like a grape or raisin that could, in some dogs, cause kidney damage.
Yeah, and for the pet parents out there, talk to us a little bit about that, because I think 15 years ago, 20 years ago, people even recommended grapes as snacks for dogs, and now terrible things are happening.
Yeah, I mean, I've had clients feed their dogs grapes and raisins, have nothing happen. I've had dogs get into like a bunch of grapes in the children's bedroom when they're having a snack and suddenly have kidney failure. So it's really dose dependent, and the toxic principles unknown. So I just recommend no grapes, no raisins, no currants,
Yeah.
and I generally kind of stay away from dehydrated fruits because they're high in sugar. Usually they have some kind of preservative on them, like sulfur dioxide. And you never know what's going to be like the next grape or the next raisin. Like, is
Right.
dried cranberries going to be the next one?
We like you said, we don't know the toxic principle, and some thoughts might be that there might be a mold or aflatoxin on them.
Yes,
it could
absolutely.
be that they were treated with some sort
Pesticide.
of pesticide. We just don't know. So you're right that they, in the either growing or production of that food, something could change, and then we can have a new problem that is because dogs and cats process chemicals differently than people.
Sure.
You can get a big surprise.
Yeah. If you're gonna feed your pet cucumber or apple or something like that, wash it first with soap and water. I use like the abrasive side of a sponge to do a wash of my vegetables before I eat them. Maybe take the skin off, because sometimes the skin can be a little bit bitter, and then you can slice it up. I have clients that give them to them as reward snacks, or just as addition to their food if they're trying to dilute the calories out, or things like peas as well, and carrots.
So let's say that you have a client. Let's say you're my veterinarian, and I feed my pets commercial dog and cat food. I feed Royal Canin, which has worked really well for us.
Right.
But I ran out, and my Chewy order is not coming, or it's 3 days late, and I have no food. What around the house do you recommend in a pinch for dogs?
For dogs, I'd probably think of like something that was commonly recommended by veterinarians as an easily digestible diet when there's some kind of digestive tract upset for a variety of causes, like maybe approximately 33% protein to 66% carbohydrate diet. And the protein could be a low-fat protein like a chicken breast, a cooked beef with the fat removed, low-fat cottage cheese, even tofu. And that's about 1/3 of the portion to 2/3 carbohydrates. That could be white or brown rice, white potato, plain oatmeal. Those are all relatively simple things that are easy for dogs to digest, and generally are not going to cause upset, but generally help when they have digestive tract upset. And dogs could eat a simple meal like that for months and not develop nutritional imbalances. When dogs go to the veterinary dermatologist and they are recommended to eat an elimination diet, if it's not something commercially available, generally the client is doing a home prepared, like a duck and sweet potato or something, or a fish and white potato, and they're doing it for months at a time. 6 weeks, 6 to 8 weeks generally is that food restriction time where they're not eating other foods and they're not developing nutritional imbalances. So you could really go an extended period like that.
But for a lifetime, we want to think about getting a recipe that has minerals and the micronutrients.
Right,
and
for longer term. But for shorter term, they could eat that for like 2 months, so to speak, and not develop like bendy bone disease or something like that. Not get a goiter because they're not getting any iodide.
Yeah,
because cats.
Go ahead.
Sorry, go ahead. Okay.
No, tell us about cats.
So cats are obligate carnivores. They don't really need to have the carbohydrates. So you could just focus more on protein. You could focus on chicken, on pork, on fish, on beef. Have it be cooked, though. I would always recommend raw meat diets over cooked meat diets, just because if there happens to be pathogenic bacteria. Cats, of course, can eat carbohydrates. They just don't really need to metabolize it. So if you are doing home prepared foods, I would probably focus on protein, unless you find like they need carbohydrate for their stools to be more formed or to be more voluminous. Sometimes high protein pulls fluid into the lumen of the digestive tract, and so stools could be softer, or there could be more flatulence.
If we're going to add a carbohydrate to a cat diet, what do you like that might be in our house?
Well, one thing I kind of think of that I've seen in some of the more available, commercially available fresh diets is yucca.
Oh, wow.
Which is a root vegetable, kind of like a carrot,
okay,
like a potato. But probably focusing on maybe a sweet potato, because it's high in beta carotene, relatively high in fiber. I just would make sure that you cook it and you thoroughly peel it, because you don't want any of the eyes of the potato, which potentially has toxins in it,
Oh, tell me
especially if
about
it's
that.
greener. Yeah, mold-based toxins can grow in the eyes, and also just if it looks green around it, there could be toxins, which I can't remember the name.
It's
So just
okay.
peel them right off.
And so you actually have quite a bit of experience with fresh food for pets, right?
Well, I've been an advocate of fresh food feeding for a long time. When I first got Cardiff, my now deceased Welshie, back in 2006, I did the Dr. Pitcairn's recipe, where I would go to the co-op and source all sorts of nutrients, and bake eggshells in the oven and remove the albumin and crush them up for calcium. And it was a pretty
Yeah,
elaborate process. So I did that for quite some time, and then we moved to more of
yeah,
a commercially available raw meat diet that I would cook along with a raw meat kibble. And then when he started having IMH episodes, I really wanted a fresh, moist diet. So that's when I discovered Lucky Dog Cuisine, which Janice Ellenboss, who's a friend and professional associate in South Carolina, makes. She makes a cooked frozen product that's shipped to clients' homes. And many of my patients are still eating that food, but I've had the opportunity very recently to become part owner of a LA-based dog food company called Pure Dog Food. It's
wow,
all
that's
veterinary
exciting.
nutritionist formulated. It's undergoing some branding changes to just become pure, with a new website and retail experience. So it's going to be website and pet health information, and eventually cat formulas, and also some pet products like bowls and leashes. It's going to be kind of like, I like to think of it as like the Goop of the pet world industry, because I love what Gwyneth Paltrow has done with the business with her Goop website. I may not believe in all the health claims, but I think some of the health claims are good. But anyway, so puredogfood.com, you can check it out. There's 5 recipes. There's a chicken and quinoa, a chicken and rice, a turkey and rice, a fish and whole wheat pasta, and a beef and potato/pumpkin, all of which have other vegetables in them as well, and a vitamin mineral mix. So it's very popular in Southern California. It's shipped directly to clients' homes, but also available at Healthy Spot, which is a really great pet store in the LA area, and a couple of human food markets like Erewhon, Jade's, and Coopportunian Market. Can be FedExed anywhere overnight. So I'm introducing that to a lot of my clients. I really like the packaging because it comes in BPA-free recyclable pint and quart containers. They fit very nicely in your refrigerator. So all you have to do is defrost and scoop out the portion that your pet needs, either like a portion of the pint or quart, because I've calculated for your pet the measurement that you should be
Right,
feeding.
right.
Or I love it when clients use a kitchen scale to measure the pet's
Yeah,
portion in ounces, especially for smaller pets. It's really crucial to be
yeah.
very precise. So you get that kitchen scale, put the plate on, zero it out, put on your portion, you have an exact number, and that's what your pet feeds.
It's a really good topic, but I think it's maybe too much in the weeds. But I'm going to talk about it anyway. Weight versus measure. There, Dr. Alex German, who is a board certified nutritionist in, I want to say, Liverpool, England. I'm sorry, Alex, if I'm getting that wrong. Dr. German, if I'm getting that wrong. But he does presentations where he has different people measure a cup of food,
Oh, I love it.
and then the weight difference is spectacular. I mean, I'm going to throw this number out there, and then maybe I'll get his actual data. But by like 20 or 30%,
Wow.
the different, it looks like a cup. Even
Yeah.
the same person measuring it.
Maybe like a flat cup versus a rounded cup.
Well, even a flat cup, because particularly in small portions, because of just the percentage of that you happen to get with the different kibble shapes and everything.
Sure.
So for someone who's super into it and committed, weight is definitely better than measure. But in Europe, they do almost all their baking and cooking with weight, and in America, we do it with measure. And so we're just not in the habit of it. But it is much better.
And also, when I talk to clients, like, oh, I'm feeding my pet one scoop, and the scoop is like a huge, massive scoop, like a coffee cup, and they're giving their dog that needs 3/4 of a cup and a half of dry food per feeding, and they wonder why the pet is overweight.
Yeah, so a cup doesn't mean any vessel that holds a liquid.
Yes, it's really like.
Well, versus yeah.
I love Ziwi Peak as a dehydrated food for when clients want to say a client wants to feed a kibble. Instead of feeding traditional kibble, which I don't love because it's feed grade ingredients, it's high heat cooked. When you take starches and high heat cook it, it can create acrylamide, which is a known carcinogen, and your pet could be eating that day in and day out. Why do pets have cancer? Got to wonder about those things. But Ziwi Peak is an air dehydrated food, and it comes in kind of a flake formula. And they provide a scooper in their food, which is a half of a cup. So sometimes I have to kind of go over exactly how many cups, how many scoops the pet should be eating in order to maintain their weight or to lose weight.
And we've been talking a lot about fresh food and dehydrated food. You have time to spend to get into all the details, but for people that don't have you in their living room for 3 hours, I want to talk a little bit about safety, because when you have fresh food, you really need to clean that bowl every single day.
Yes.
And you need to think, particularly if you're thinking about dehydrated or raw proteins, you need to think about that they are getting on your pet's face and maybe their forelegs, and be careful.
We're going inside.
Oh, good.
It's cold.
But you are a mobile vet after all.
We're gonna go inside. Hey, here's Phil. Here's who helps me to run my business.
Oh, yeah.
Husband and business manager.
How home is. Wow.
This is our home. This is our friend's art. Chase Langford. He's an amazing artist.
Wow.
We purchased this panel from him. And
all I have is a dog muzzle for art right now.
Here's our fireplace inside. And my father used to work for this company, Knoll, and so I love these chairs.
My gosh. Wow, how lucky are you?
We've had these since I lived in Emmaus, Pennsylvania when I was 14.
Wow, those are gorgeous. I love that chair. It's a name, right? That's like an architectural, it has a name, that chair.
They're called Breuer chairs.
Okay.
And because here's the designer's stamp, embossment right there, Marcel Breuer. They're also known as Wassily chairs.
Wassily, that's a name I'm familiar with. So who knew we were going to get home veterinary
There's more plants,
interior design.
I love plants. I love my plants. If I wasn't a veterinarian, I would have some kind of greenhouse, and that's part of my retirement plan, is being a gardener full time.
Wow, that is awesome.
So much more comfortable.
There you go. Now we're both by the fire.
Yes.
So the last thing I want to talk about is pain. So we talked about weight management for pain. If you can't get pain meds or get to your vet, what other things do you recommend? I know you have a lot of natural remedies. So for the short term, if you're not able to get to your vet, you talked about some other things. And you're trained in acupuncture. So talk to us a little bit about all those things.
Well, I mean, owners should not just start sticking needles in their pets. But certainly they could have a house called Veterinarian come to the home to do multimodal pain management. And what multimodal means is that we're trying to use different modalities to hopefully reduce the reliance on medications that could have side effects. I'm a big fan of medications.
I think you're either it's me or you, but you're coming in staggered for me. Is there maybe your internet is doing something weird?
I'm looking like I'm connected. Can you?
Oh, okay.
Maybe any better now?
It might be me. So let's just keep going. I don't know what's happening on the receiver side.
I have a live flashing thing in my upper left corner. I don't know if that's on your end or not.
No.
Okay.
No, but go ahead.
Okay, so I try to practice multimodal pain management, and that means that we are striving to reduce reliance on medications by using other modalities. So weight management, as we already discussed, and the medications that I commonly think of for pain management are anti-inflammatory drugs, generally non-steroidal anti-inflammatories. Most pets would take a common drug like carprofen, which is also known as Rimadyl or Novox, or meloxicam, which is commonly known as Metacam or Meloxidil, or gabaprant, which is often known as Galliprant. So those are probably three of the most popular that I see. And they're effective, but they can potentially cause digestive upset or problems with kidneys or liver, even blood clotting. And then other drugs for pain like Tramadol or gabapentin can have a sedating effect, or they could slow down the digestive tract, or there's controversy about if gabapentin is even effective in pets. So I try to reduce my patients' reliance on those by using fish oil as a natural anti-inflammatory, getting some turmeric in there as well as an anti-inflammatory.
And so fish oil, because a lot of people might have fish oil at home.
Yes.
And if it's something that they want to try, is that safe?
Generally, yes, but I would recommend using a product that is geared for pets because most human products have a citrus or mint flavor, which is unappealing to the pet. But that also could just be in the capsule itself if you have a human product. So if you were to pierce it, perhaps you could squeeze it. But it's important to know the appropriate dosing. And that's why generally we'll rely on products like Nordic Naturals Omega-3 Pet, which has a liquid form and a capsule form. And it's very simple to calculate your pet's dosing with either. And if your pet doesn't like a capsule, then the capsule could be pierced and squeezed into the food, or the liquid could be easily dosed out based off of a teaspoon or a little eyedropper.
So kind of the same thing as, pharmaceutical medication. Even the natural stuff is dosed by the weight of the pet.
Generally,
So,
yes. Yeah,
so
and
getting a veterinarian's input is still pretty important.
yeah, absolutely. But I mean, we don't have to think of just things that are orally taken. If you have an older dog that has arthritis, get them to lay on a heating pad so you can have warmth directly on the site where the joints are affected, or get something like an CC loop, which is a pulsed electromagnetic frequency unit. It's a ring that fits over their joint or could fit over an affected body part like a hip or shoulder, and that provides a 5-minute cycle of pulsed electromagnetic frequency that can really significantly help to improve your pet's comfort. And what I love is that a CC makes a insert that goes into the Sleepy Pod Air and Atom pet transport carriers, which are all airline approved as well. So a smaller creature like a cat or a dog could crawl in and just receive a therapeutic benefits while just sitting in the air. Actually, I have a couple patients that love to go in there, and owners are always so surprised about how much the pet likes being in the sleepy pod with the CC loop when it's turned on. It's like magic. It calms them down and it
Carrier
helps their
training
pain.
101.
Yeah, it's great.
Yeah, that's great. So, but if you don't have an CC loop right now, I think most people have a heating pad, or you can even
Yes.
make a makeshift heating with a hot water bottle. But
Yes. Gel pack.
talk about safety there a little bit for us.
I'd definitely be careful with a heating pad, especially if your pet is going to lay on it, because sometimes heating pads become damaged if they're folded. The electrical wiring could become exposed, and if there's any kind of moisture that ends up on the heating pad, there's going to be more of a heat transfer. It's a little more of a concern for a geriatric pet that may not be as aware or is able to get themselves up and move. Say you have like an older female dog with urinary incontinence that also has arthritis, and she urinates on the pad and she's sleeping on the pad all night, that she could potentially get a thermal burn. So it's really important to not have them just lay on a pad, have it maybe be used at a lower temperature. And I love gel packs that could be put in the microwave or put in warm water. They also could be used for cold purposes, because sometimes when you're dealing with arthritis, you don't always want to have it be hot. If you have a really significant arthritis flare-up, maybe cool would be better to try to shrink some of the blood flow to the site to try to manage the pain, and then for like 24, 48 hours doing cold compresses, and then move to warm to try to reinstitute some blood flow to the site. So you can do a combination of things. Sometimes warm and then cold. Warm. I had a greyhound patient with a spinal tumor that was so painful. And this dog had 2 bouts of radiation as well, which significantly helped. But it got to the point that like I couldn't needle the dog, I couldn't laser the dog. The dog would just scream in pain. So I would do alternating cold and warm compresses going down its spine, and it tolerated that, and it made him more comfortable, and it just provided a little bit of better quality of life. So there's a lot of tricks and tools you can do if you partner and have communication with your veterinarian in doing so.
Awesome. Well, thank you so much for coming tonight. I really appreciate it. Maybe we can touch base again as we move through this crazy time with more ideas for how you can help your pets at home, and even advice for how to find. Actually, do you have any, or are there any services for house call vets that are digital? Or how would you recommend if someone wants to give it a go? How would they do it?
Well, there are some
in Philadelphia or in Texas.
There are some app-based systems, but they tend to be mostly congregating around bigger cities like Vetted and Chewy. But at the same time, I would ask your veterinarian if, hey, in these challenging times of COVID-19, would you be able to provide a house call? Because vets are starting to rethink a little bit. I communicate pretty frequently with the president of the Southern California Veterinary Medical Association, Peter Weinstein, and he's advocating that with the challenges to get pets into the hospital, maybe now veterinarians think about adding some kind of house call based service as a convenience to the client, and also as a revenue generator.
But I want to call that out because sort of what you and I talked about in the beginning, that it takes so much more time. You have to drive to the person's house. You're going to be there longer. You may not have all the equipment that you need or medications that you need. And then you have to drive home. So it is reasonable to expect that that will be more expensive.
Absolutely. But it can be worth it. I mean, it's really, I don't really have a good relationship with my own human doctor right now. I'm kind of in flux with that, but I really like when I have a doctor that cares about my health. And I find that is something I'm willing to pay for if I can get that.
For sure. Yeah, I think it's wonderful. If it's something that you can afford, it's great. But I just want people at home to know that particularly in a time where a lot of people might not have the cash flow that they did 2 weeks ago, we're going to have to be creative about how we solve all these problems. But as I've said before, and I will say again, I think that veterinarians are the most incredible, generous, kind, amazing, resourceful people. And they want to help you and they want to help your pet in any way that they can and still survive. So if we are patient and kind and communicate with each other, and which is sometimes hard under these stressful circumstances, but I think we're going to problem solve this if we all work at it together.
And also, I mean, if you have that existing provider-patient relationship, you can do telemedicine.
Yeah.
You can have a Skype, FaceTime, however you want to have that. That video call with your client, and they can show you things on their pet, and you can consult, you can treat, you can ship them medications, they can come pick up medications, you can use online pharmacies. There's all sorts of ways we can go about doing this as long as you have that up-to-date care provider-patient relationship.
So we talked about this a little bit last night, and I just want to be super clear that those rules and regulations can be specific to the state. And so if what we say here in Philadelphia might not be what you can do in California. So we just want to be aware of that. And most of them for that client-patient relationship requires that the vet has laid hands on your pet in the past year, done a physical exam in the past year. And I think we're all going to see as this situation progresses, if the state and federal laws change, and because we all want to do the right thing. Those laws are in place because your pet can have a really big change that we're not aware of, and that's dangerous. So we put those laws in place for a good reason, but we might have to be a little bit more flexible right now. So stay tuned, because we're going to keep talking about all those fluid changes as we go. So will you come back and talk to me maybe in a couple
weeks? I would love to.
All right.
I don't get to see you often enough, so I can see if I can see you for an hour. It's a pleasure. There's no next conference for us to plan for yet.
I know, not right now, and everything's getting canceled, which is such a shame.
Let's hope for Super Zoo over the summer.
Yeah, I'm gonna hope, but I'm worried. If we have Super Zoo, then let's plan a celebration dinner.
Absolutely.
And also, I want people to be able to ask questions. So for the next time you join me, I'll have pet parent and veterinary questions directly from everybody out there. So you can write them in underneath here, and we'll talk about them next time.
I look forward to it.
So stay safe out there.
You too.
Say hi to Jane fans. We think she's awesome. And everything she does, we appreciate that too.
Are you watching Maisel?
Oh, yeah. Haven't missed an episode. Haven't missed an episode.
Good in that. Emmy Award winning again.
Nothing but the finest for you.
Her shelf is getting really heavy, by the way. All her Emmys and SAG Awards, things like that. Yeah. She has to reinforce the shelf.
All right. Well, thank you so much. Have a great night.
Absolutely. Take care.
Bye.
Bye.